global aging data. My name is Hunter Green, and I, along with my co-presenter Tristan Phillips, will be presenting today. This webinar should run about 45 minutes, and then we'll have time for questions at the end. But if you have questions throughout, feel free to ask them in the chat. The topic of today's webinar is an introduction to CHARLS, the sister study of the HRS for China. We hope that we can familiarize you with CHARLS if you are not already familiar with the study, by giving some background information about the study and letting you know how it might be different than other HRS family studies. We will also let you know about some of the gateway tools and products we offer around CHARLS, and then Tristan will be doing some examples of analyses using CHARLS data. These analyses examples should be especially interesting for those who are thinking about using CHARLS or who might have just started using CHARLS. CHARLS stands for the China Health and Retirement Longitudinal Study. It is a nationally representative sample of the population aged 45 and older living in private households in China. So CHARLS does not include people who are already living in institutions such as long-term care facilities. In addition to being nationally representative, the sample also has urban and rural representation. The initial sample was recruited in 2011 and 2012 using a stratified multi-stage probability sampling of households at all county-level units of China except for Tibet. At baseline, if a household had people older than 40, one of them was randomly selected. If the selected person was aged 45 or older, they became a respondent. If the selected person was between age 40 and 44, they were reserved as a refreshment sample and then added to the CHARLS sample once they reached age 45. So far, CHARLS has introduced refreshment samples at Wave 2 in 2013, Wave 3 in 2015, and Wave 4 in 2018. Respondents were followed up every 2 years through Wave 3 and every 3 years thereafter. The study was designed to better understand the socioeconomic determinants and consequences of aging in adults living in both urban and rural areas of China. Also, the study protocols and survey instruments of CHARLS are highly comparable to the health and retirement study in the United States. The CHARLS sample includes one age-eligible respondent per household along with their spouse regardless of age. For example, if someone who was age-eligible was interviewed, but they had a spouse who was younger than 45, the spouse would also be interviewed. I mentioned in the last slide that CHARLS does not include people who are already living in institutions. However, CHARLS does follow respondents into institutions. In addition to the core interview, CHARLS has also collected non-blood biomarkers such as anthropometric measurements and blood pressure, grip strength, and lung function measurements at waves 1 through 3, as well as venous blood samples at waves 1 and 3. CHARLS also has conducted exit surveys on deceased study participants starting at wave 2, a life history interview between waves 2 and 3, and an in-depth harmonized cognitive assessment at wave 4. If you would like to know more about CHARLS, they have published a cohort profile in the International Journal of Epidemiology. So here's a little bit more information about the CHARLS data collection. As you can see, there's currently been 4 waves of CHARLS that have data collection for researchers to use. The baseline CHARLS was fielded in 2011 and 2012, and then follow-up surveys have been fielded in 2013, 2015, and 2018. As you can see in the response by wave graph towards the bottom of the slide, that CHARLS has had a pretty good follow-up rate, especially after wave 2. You can also see the refreshment samples that I mentioned before that were added at waves 2, 3, and 4. If you are unfamiliar with the HRS family of studies, it'll be interesting to know that CHARLS' sister studies around the world include 45 countries. Also, this list is continually growing. That's a lot of comparable information collected in different countries. These studies are known as sister studies because they have a lot of similar characteristics to CHARLS. They are population representative of older adults. They are longitudinal, so they follow the same person over time. These studies are also multidisciplinary, so they are not solely focused on health or economics, but they try to capture many different parts of participants' experiences. They also have enhanced economic data and integrated biomarkers. Finally, the data collected from these studies are publicly available for researchers to use for free anywhere in the world. In the graph on the right, you can see the interview periods for some of the other sister studies. One of the products that the Gateway produces for Charles are harmonized data. Harmonized data are created to provide Gateway users with research-ready variables which are comparable between sister studies. These variables are defined as similarly as possible across waves and different studies. Each dataset combines all available waves from each study, and each individual is identified as one record. So these datasets are referred to as FAT files. In addition, all variables use intuitive variable naming conventions when possible. For example, the harmonized variable R1 BMI indicates the respondent's BMI value as measured at wave 1. Study-specific variable names are also used to identify inter-study differences. For example, in the Harmonized CHARLS, there's a variable called R1LBRF_C, which indicates the respondent's labor force status at wave 1. That _C identifies that there's something specific to the Charles version of this variable that may be different in other studies. In this case, Charles uses different categorizations of labor force status than other studies. These differences exist in all studies, and they can be both a benefit but also something to be aware of when planning your analysis. Also, the harmonized datasets include spouse versions of most variables. For example, the variable S2work indicates whether the respondent's spouse is currently working at wave 2. Finally, all of the harmonized variables have been built to account for any survey skip patterns. We have just finished completing version D of the Harmonized CHARLS, and it incorporates data from waves 1 through 4 and the life history survey of Charles into a single longitudinal data file. This version will be available for download soon. As you can see from the slide, one of the many benefits of using the harmonized data is that instead of dealing with 68 different files to look at people who have been part of Charles for all 4 waves, you can use one file which has this information already combined. It is important to note that the Harmonized CHARLS dataset does not include all of the survey questions that are asked by Charles. Instead, harmonized datasets focus on survey measures which are most often used or requested by researchers, and which are most comparable between waves of Charles and between Charles and its sister studies. Version D of the Harmonized CHARLS has 14 sections that you can see listed here. This includes the physical measures, assistance and caregiving, stress, and psychosocial sections that are new to version D. Here's an example of what variable harmonization looks like between studies. If you recall, one of the things I mentioned in a previous slide is that harmonized variables account for survey skip patterns. So we can see a few things happening here. On the left, we have the Charles wave 1, and this is a survey skip pattern inside of the Harmonized CHARLS. At wave 1, respondents are asked, have you ever chewed tobacco, smoked a pipe, smoked self-rolled cigarettes, or smoked cigarettes or cigars? The respondent can answer yes or no, and these responses are coded as 1 and 2 respectively. If the respondent answers yes, they are then asked, do you still have the habit or have you totally quit? Let's say we want to make a harmonized variable, which we have done, and we decide to call this variable R1 SmokeEv to indicate whether the respondent has ever smoked as of wave 1. Harmonized variables are always going to have the same value codes, so a no will always be coded as a 0 and a yes will always be coded as a 1. In this case, the variable transformation is quite simple. We are just going to recode the no responses to the first question from 2's to 0's. However, we want to make sure that our harmonized variable is comparable between different harmonized datasets. So on the right, we have Elsie, which is the Brazilian sister study of Charles. At wave 1, Elsie respondents are asked, do you currently smoke? The respondents can answer yes, they smoke daily, yes, they smoke less than daily, and no. And these responses are coded as 1, 2, and 3 respectively. If the respondent answers no, they are asked, have you smoked in the past? The respondent can answer yes, daily, yes, less than daily, and no, they never smoked. And these responses are also coded as 1, 2, and 3 respectively. If someone currently smokes, we know they have ever smoked, so respondents are coded or who are coded as 1 and 2 for the first LC question get coded as 1 in our harmonized variable. And we think that those respondents to the second LC question saying they have ever smoked are comparable to the Charles respondents who have said that they have ever chewed tobacco, smoked a pipe, smoked self-rolled cigarettes, or smoked cigarettes or cigars. And those who responded to the second LC question saying they have never smoked are comparable to the Charles respondents who have said they have never smoked. This example should give you an idea of the advantages of harmonized variables, especially that the value codes are going to be comparable between different harmonized datasets and their survey skip patterns have been accounted for. One thing that we provide with all harmonized datasets are detailed codebooks. These codebooks introduce the harmonization project and the study itself, and they overview survey timing, survey design, and sampling framework. Some of the things we have already gone over so far today. In addition, the codebooks discuss how you might weight your analysis and whether values have been imputed. We also detail the specifics of the harmonization process and divide variables into sections based on domain. In a previous slide, we saw the 14 sections of the Harmonized CHARLS version D. Inside of the Harmonized Codebook, we summarize each set of variables. This is an example of the smoke ev variable. As you can see, both the respondent and spouse versions of the variable have been created for each wave. Another thing you can see is that we have assigned special missing values to these variables. A special missing value is a way to indicate missingness with some more information, and these are included as part of SAS, Stata, and SPSS. For example, 4 respondents at wave 1 answered that they do not know to this question, so we've included that information here. In addition, we also detail the variable creation and any assumptions made in that creation, and we highlight any differences between waves of that study and any differences between this variable and the HRS version of the harmonized variable. We use the HRS as our basis for comparison between all of the different studies. Here, we have some basic information about how the SMOKA variable is constructed, and we note that there are no significant cross-wave differences in CHARLS in this question. However, we do note a difference with the RAND HRS and Harmonized HRS. This difference is that in the HRS, whether the respondent has ever smoked or not is determined by the following question: have you ever smoked cigarettes? However, in CHARLS, whether the respondent has ever smoked or not is determined by the question: have you ever chewed tobacco, smoked a pipe, smoked self-rolled cigarettes, or smoked cigarettes and cigars? Depending on what you're researching, that difference might be important for you to be aware of. So while these detailed notes take time for us to write, they can really provide invaluable information about the comparability between studies. The last thing we include in the Harmonized Codebooks is a list of all the variables from the original dataset that we used in the creation of that variable. This information is helpful if you want to go back to the study and look at the questionnaire or the study codebooks and see exactly what variables we used and perhaps why. You can download the Harmonized CHARLS data file, codebook, and Stata creation code from the CHARLS website's data page. The Harmonized CHARLS data file is distributed in Stata format, but this dataset can also be easily opened in SAS, SPSS, and R. We also provide the creation code so you can have the exact code we use to build the dataset. We've created many harmonized datasets which are comparable to the Harmonized CHARLS. These include the RAND HRS and the Harmonized HRS that covers the United States. Briefly, I'll mention that the Harmonized HRS is a supplement of the RAND HRS. So the RAND HRS is the main harmonized file, and some additional variables that help with cross-country comparability are included in the Harmonized HRS. The MHAS covers Mexico, ELSA covers England, SHARE covers most of Europe and Israel, and CHARLS covers Costa Rica. In addition, KLOSA covers South Korea, JSTAR covers Japan, Tilde covers Ireland, and MARS covers Malaysia, which happens to also be our newest harmonized dataset. You can go to the Downloads page of the Gateway website to find the links to download all of our harmonized datasets, harmonized codebook, and Stata creation code. This data creation code is needed to create the KLOSA and share datasets. All of the other harmonized datasets can be downloaded on the gateway or at the website of each respective study, depending on the study. On the Downloads page, you can also register for quite a few of the HRS family of studies, including CHARLS, by clicking the link in the blue box at the top of the page. That wraps up my portion of the webinar. Thank you for your attention. My colleague Tristan Phillips will take over from here and demo a few other features of the Gateway website before getting into some analysis examples.
Thanks, Hunter. Yeah, so we just wanted to briefly show you about where you can find a little bit more about CHARLS on the Gateway website. So to do that, I'm going to jump over to our website, g2aging.org. And if you'd like a review of some of that basic information that Hunter told us about the CHARLS study, you can click on the study overview for CHARLS. This is under Surveys at a Glance. You can click here on CHARLS. And it's going to also cover things like the sampling frame, data collection, whether there were any data linkages, how you get access to the data, and what are the harmonized data sets and how do you get access to them. You can also see this for any of the other studies. So you could also, for instance, switch to the Korean study, KLOSA, and see the same information collected about KLOSA. And so it's really helpful to get an idea about how studies are comparable or how to get access to them. In addition, on the Gateway, we have all of the survey metadata or survey questionnaires. So you can see for CHARLS here, we have CHARLS waves 1, 2, 3, and 4. That's for the core interview. We also have data or survey data on the end of life interview, the life history interview that Hunter mentioned, CHARLS life history, and the health assessments that were done, the anthropomorphic measurements that were done as part of CHARLS also. And if you wanted to, we can go back to this core interview. For instance, we could go into CHARLS wave 3 here, and we could look inside of any one of these survey modules. CHARLS, like many other surveys, are divided up into modules, which focus on specific topics. We could go into health status and functioning. And you can see that the first questions that get asked are, I have some questions about your health. Would you say your health is excellent, very good, good, fair, or poor? You can get asked that question. Or you can get asked, next, I have some questions about your health. Would you say your health is very good, good, fair, poor, or very poor? So you can see that it's a slightly different scale that's used. This first scale for DA001 is as comparable to many US studies, kind of use this excellent to poor scale, whereas it's a little more European to use this scale, which is a little better centered, going from very good to very poor. We also, you can search. So for instance, if you were interested in smoking, you could say, show me smoking questions from CHARLS. I'm going to click CHARLS here. We can search. And that's going to show us in any one of the surveys. So 2008, 2010, we'll look at 2014 here, wave 3, all the questions that relate to smoking. So if we scroll down here, we can see there's a question which Hunter pointed out. Have you ever chewed tobacco, smoked a pipe, smoked self-rolled cigarettes, or smoked cigarettes or cigars? And you can click in there. For CHARLS, we do have the Chinese text as well as the English text. For all of the studies, we always have the English version, and sometimes we have the original English version too. And you can see the answer choices are coded that a yes is coded as a 1 and a no is coded as a 2 inside of the CHARLS data, which can be quite helpful. More to the point of looking at kind of cross-study comparability, we have these concordance tables. So for instance, if we wanted to look at kind of health across different studies, we have this self-reported health question, which we just saw inside of CHARLS. And you can see the different scales that are used by different studies. So you can see in the US, the excellent scale is used, same in MHAS for Mexico. In England, they use both scales, which is what we also see in Charles, right? They use both scales. So you can see how it varies by study. And then you can also see other differences. So for instance, there's no self-reported eyesight that's asked as part of Charles, but it is asked as a lot of other studies. And instead, Charles does ask questions about self-reported distance eyesight and near eyesight, but not just an overall eyesight. So this can be, these concordance tables can be really helpful to get an idea of what can be compared across different studies. We also have some graphs and tables. So with these graphs and tables, you can compare a lot of different items. If you here click on survey data, I think we have over 100 different topics you can compare across all the studies that we have data on. Here's a chart looking at any financial transfers from children in 2014 across quite a few countries. And we can actually toggle this. So one of the things that we see is that for China, for the Chinese households or respondents, more than 70% of them report having financial transfers from their children. We see something similar, but not quite the same magnitude of about 60% of the households in South Korea receiving some financial transfers from their children. But beyond that, there's really low levels, especially in some of the European countries, France, Spain, Switzerland, Belgium. So it gives you an idea of some of the variability globally, in this case in financial transfers. But there's a lot of this diversity throughout the world in aging and the aging process. And so we really try to highlight those things on the gateway. We also have an index of publications, which I'll mention last. So for instance, if you wanted to find papers which have been published using the Charles data, which can be quite helpful, it's not always easy to find those papers. For instance, using PubMed or Google Scholar, just using the word China or Charles doesn't always work. So we can see here papers which have all been published using Charles. And you can also sort them by topic. So for instance, let's say we're interested in cognition and Charles. We can see here that we have several papers just looking at cognition. Here's a paper on afternoon napping and cognition in Chinese older adults. And this is from the baseline assessment of Charles. And we have links to the paper or to find it on Google Scholar, and also information about the abstract. So this can be quite helpful to get an idea of what's already been done as regards a study. All right, so let's get into our example analysis. And we do an example analysis because we want to give you kind of an idea of some of the benefits and the advantages and the possibilities of using harmonized data sets. And in this case, we're going to use the harmonized Charles. And we're going to do this in two parts. First, we'll do an analysis of Charles just using the harmonized Charles data set. And then we're going to do a cross-study analysis. And this is really when these harmonized data sets become quite powerful, because as Hunter showed, we have measures that are really comparable across these different studies. So we're going to compare Charles and KLOSA. So we'll compare China with South Korea. So two very different countries, but from the same region of the world. So the research question that we're going to use to kind of motivate this is going to be, how does the prevalence of disability increase with age? And do we see different patterns for men and women? And do we see different patterns for individuals in urban or rural areas? So the first step will be to download the harmonized Charles. This is kind of assuming you've never worked with this harmonized data set before. We want to download it. We're going to identify our relevant variables. We're going to load the harmonized Charles data. We're going to create some additional variables particular to this analysis. We're going to apply weights, and we're going to do some univariate analyses of disability prevalence and a multivariate analysis of disability prevalence. So as Hunter showed, you can download the harmonized Charles dataset from the Charles data page. Once you've signed up with Charles for an account, you just need to request and then it'll be approved, download it. As Hunter mentioned, so we just releasing today version D, our newest version of the harmonized data. So that's not quite available on the Harmonized CHARLS website. We have version C available on that website, though we shortly will have version D available on the CHARLS website. And then we want to identify relevant variables in the Harmonized CHARLS. So this is going to be a cross-sectional analysis. So even though CHARLS is a longitudinal study, I've decided just to pick one wave that we're going to look at for simplicity. So we're going to pick CHARLS wave 4, the latest wave of CHARLS to be released, which was performed in 2018. And these are the variables we're going to take from that data set. So we're going to take a unique identifier, which is always important so that you can merge back that data with other CHARLS data, for instance. It might be important. We're going to create an indicator of participation at wave 4. The variable is called INW4. We're going to take an analysis weight. We're going to get a gender variable called RA gender. We're going to get the age at wave 4. That's called R4AGEY. You can kind of get an idea here of how all our harmonized variable names work and that they're quite intuitive. So as you might be able to guess, the wave 4 indicator of whether the respondent is urban or rural is named R for rural. And then we're also going to take to kind of model disability, we're going to look at a summary score of activities of daily living called R for ADL5. So you might wonder, I'm not familiar with the Harmonized CHARLS. Where do I get this list of variables? And so there's a couple ways to get this. One way is on the Gateway website. You can also search, for instance, by subtopic. So we can look here. We can say, let's say I want the analysis weights. And here I'm going to click on Harmonized CHARLS. And we can search. And what this is going to give us is the different analysis weights that are part of the Harmonized CHARLS. So we get the variable name, and we get a description, and we get what kind of variable it is. So this can be quite helpful. The other way you can do this is you can look at the codebook. So as Hunter mentioned, every data set is accompanied by a codebook. So if we open the Harmonized CHARLS codebook here, this will be the previous version, not the updated one. You can see we have some bookmarks built in. Let's open up the health section. And we can go down and let's look at our ADL summary variable. So the summary of ADLs. And you can see we have different ADL summary variables and what those all encompass. You can see here we have some information about ADL5. So that's the variable we're going to use. So it's a 5-item summary of any difficulty with activities of daily living. The activities of daily living included are bathing, dressing, eating, getting in and out of bed, and or using the toilet. And it's the sum of these. So that means a respondent can have a score as low as 0, meaning they don't have issues with any of these 5 activities, or a score of 5, meaning they have a difficulty with every single one of these activities. And so these are often used when we talk about disability because it talks about the presence of a limitation that might require someone to help with them. They might need some assistance or caregiving. For instance, if you have difficulty bathing or dressing, you might need someone to help with that. And so in old age research, that's often referred to as an old age disability. So that's also a way to find those variables. Lastly, if you just download the data set itself, all of the variables include variable labels and value labels. So there's a lot of information inside of the data set itself. So now that we've established what variables we're going to use, we're going to load them into Stata. We're just going to use Stata for this example. We do have some examples of a similar analysis using SAS also on our website, and you can download that from the documentation page on the Gateway, which is where we'll also place the Stata code from today's webinar also on that. The Harmonized CHARLS is, of course, like a very large data set because it's a FAT file, as Hunter mentioned. So that means, for instance, For age, we have an age variable for waves 1, 2, 3, and 4, right? So there's a lot of variables involved for all of the respondents who are part of CHARLS at any wave. So for simplicity, we're just going to pull out the variables we want for this analysis. This is also really helpful if you have, for instance, a smaller version of Stata that might only allow, I think it's like 6,000 variables to be loaded at once. So we're just going to kind of limit it. We're not going to load the entire harmonized Charles. So we're going to pull out these variables, and I'm going to jump over to Stata so we can kind of walk through this. So I've pulled out these variables. You can see that at wave 4, there was 19,816 individuals who participated at wave 4 of Charles. There's also a little over 5,000 people who didn't participate. So these are probably people who participated at waves 1, 2, or 3, but then were lost. They were kind of lost to survey attrition, and they were not interviewed at wave 4. So that could be because they passed away, and we might have information about why they passed away in the end of life data, or it could be that perhaps they moved or they weren't available for this. So we have an idea there, and if we look in Stata at our variables, you can see that we've loaded in our variables that we requested. So the next step, we're going to create some additional variables. We're going to look at age. We know that we generally expect disability, especially this kind of disability we're talking about developing kind of a functional limitation at old age, to happen, not for people at 45, but for people who are quite a bit older. This is a part of the aging process for most people. We're going to kind of categorize ages. We're going to make 5-year age bands, and we're going to do that in Stata using an egen command. As I mentioned, this data code will be available. So if you're not familiar, for instance, with this egen command, you could look at it and find out some more about it through Stata help. We're also, instead of using our kind of continuous variable of ADL5 running from 0 to 5, we're going to make a variable called R4 limitation. And that's just going to be an indicator of whether they have no limitations or they have any limitations. So we're going to recode anyone who has a value of 1 through 5 for ADL5 as a value of 1. So we're going to get a binary variable of whether they have no limitations or any limitations. So we can jump back to Stata briefly, and we can look at this. So the first thing we can see is that when we sum R4AGY, we're going to get some summary statistics, that it runs from age 17 to 118. That might be confusing at first because, of course, Charles is an aging study. We know that the sampling starts for people who are at 45. You might be wondering, why is there anyone who is 17? But if you recall, so Charles includes younger spouses. So presumably this 17-year-old who was part of Charles at wave 4 is a much younger spouse of someone who is 45 or older inside of the survey. And then we're going to make our age categorical variable, and we can tabulate that variable to look at our sample sizes. So you can see we've got pretty good sample sizes here. That last group of 80, that includes anyone 80 and over, right? We set that from 80 to 120. So that's going to include everyone. So it's not quite a 5-year age band, but it's just an age 80 or over band. But for most of these, for all of these, we have at least 1,000 people, and for some more than 2,000. So that's helpful. Another thing we could do is we could cross-tab this with gender. And we can see how many men and women we have in each category. So one of the things that you see is that we have roughly equal numbers of men and women inside of Charles, which is to be expected. There's probably, of this age group, roughly equal numbers of men and women inside of China. So this is population representative. But we do see that we have, particularly at age 45, we have more women than we have men. It's not quite equally distributed as it is for some of the other age groups. And that often happens, especially at working ages. Men are more likely to be working during the day when an interviewer might come to the house, so they're not available for an interview. These things can be adjusted for with weights, and Charles provides weights. So we're going to talk about that also. We can then look at our limitation variable, and we could tabulate that limitation variable that we just made. You can see that we have at wave 4, we've got 3,400 people who had a limitation, but for the majority of people, 1,600, 16,000 of them, they don't have a limitation. So we're really going to be focusing on these people who had a limitation and why. So if we jump back, we can look at the next thing we're going to do is we're going to apply weights. Charles provides a number of different weights, both household and respondent level. Since we're looking at disability, which is something that happens to an individual, we're going to be using respondent level weight, so an individual level weight. We want it for wave 4. And this weight that we're using, which we use TRESPB, that's a weight that accounts for the non-response at the household level and inside of the household level. If you wanted to find out more information about that weight, I would suggest you could go back to the code book. We can go down to person level weights. And if we go down to our how constructed text, you can find out more information. So here we see WTRESPB is the individual cross-sectional weight with the household and individual non-response adjustment. So we've accounted for both the probability that the household did not participate and that a particular individual inside of the household did not participate. And to use our weighting inside of Stata, we're just going to say SVY set. And we can say probability weight is equal to this weight that Charles has provided. Some studies who are sister studies of Charles will also provide cluster and stratification variables. Charles does not provide those, and they can be helpful, especially when you're using complex survey design to adjust the standard errors where there's clustering, and we know that we might have a lot of households who are actually physically close together. You know, it's not a random sample of every 10 people. Instead, it's a random sample of different clusters and households inside of that cluster. So we just, because they don't provide cluster and stratification variables, we want to, be a little bit reserved in how we interpret our standard errors or significance. So inside of Stata, we're going to apply that weight. It's quite simple. And one of the advantages in Stata is that once we apply this, we can basically recall that weighting information, no matter how complex, whether it's, we could list primary and secondary stratification variables and the weighting and different things. And then when we want to actually generate estimates or a regression, we can just recall that information using this SVY command. So if we say SVY colon, and you can say a mean or a regression. In this case, we're going to be getting an estimate of the proportion of the population for R4 limitation. And we're going to start out by saying for people who the age category is 45, so that's people who are 45 to 49, 50, so that's 50 to 54, or 55, so that's 55 to 59. And we can look at those results. We can also kind of do this in one step. So instead of doing a different condition, a different command with a condition for each subgroup, we can also just add the option of over on our proportion command, and we can just say over the variable. And what that is going to do is Stata is going to look at every possible category for R4 AGECAT, that age categorical variable, and it's going to give us an estimate for that variable. So let's look at that inside of Stata. And if we scroll up here, we can see, so our first estimate, how Stata writes this out for proportion is you have proportion 1, proportion 2, because it's binary. So for proportion 2, we would estimate that for people who are in the age range of 45 through 49, that around 5% of them would have a limitation. For our next age group, starting at 50, we would estimate that 7.5 would have a limitation. And for the next age group, we'd estimate around 10% of them would have a limitation. And if we do it in that one step, so you can see kind of the advantage here, We're just going to look at proportion 2 because we're just going to be focusing on those people who have a limitation. You can see how it increases. So by age 80 and over, we would expect 43% of the individuals would have a limitation, at least one, right? That's how we've structured our variable. We could look at this graphically, and we can see the way that it really increases over time here, which is one of the things we expect with disability prevalence. So part of our analysis question is going to be this pattern that we see here for all people aged 45 and over inside of China. Do we see the same pattern for men and women or for urban and rural individuals? So for the next step, we're just going to look over men and women. And if we look at that graphically, again, we're going to see a really striking difference between men and women. So for men, if we jump back into Stata, we can see we have an estimate of 13.6% of men would have a limitation, where it's 20% of women. So that's a pretty significant difference that we would want to be aware of. Of course, we know that the age structure for men and women inside of CHARLS is a little different, though weight should account for some of that. But one of the things we also know inside of a population is that women generally live longer also. So it could be that women are living a little longer, so they're having more time to develop a disability, and men are, they're dying before they have a chance to develop a disability because of maybe some other issues. So those are some issues we could further investigate. As part of our next step, we're going to look at this limitation just over urban and rural. So do we see a divide between people who live in an urban area and a rural area inside of China? And if we look at this graphically, we're going to see a really striking divide. So 13% have a limitation in an urban area, where in a rural area, it's almost 20%. So it's a really striking divide. It's really similar to the divide between men and women, and far the magnitude of difference. So one of the things that we want to ask ourselves is, do we see a difference in the patterns, right? So to do that, we can really easily modify our command. So in that over option of the proportion command, we can have multiple variables. So we could list RA gender and R for age category. And basically what that's going to do is it's going to cross tab those variables. So we're going to get an estimate for men at all of our age categories and for women at all of our age categories. And we can actually test whether those estimates are different. So if we do this inside of Stata, although I am getting an error here. If we do this inside of Stata, we can see that you can see our populations are listed up here. So for a man at 45, and for a woman at 45, that's population 1 versus 9. So men, we would suggest, have about 4% of limitations we would estimate, whereas women have 6%. So it doesn't seem like that large of a difference, perhaps. And we can test those differences. And the way you would test those differences is by doing this kind of post-estimation test. And this is how you write it for Stata 15 and later, how you write this test. So we're going to say the estimate of R for limitation at 45, or for our group at 45 who are men, versus having a limitation for women, or for our group who's at 45 who are also women, whether it's different or not. We can see that test. We can also see this graphically. And so one of the things that we do see is that both men and women start out generally kind of at the same place, but especially, the trajectory looks quite different. Men don't see a lot of increases, a little bit here at 60, and then a lot of their increase isn't until age 80. Where you see for women, really even starting from 45 to 50 to 55, they're seeing gradual increases in every one of these 5 age bands. So suggesting that actually men and women do have a slightly different pattern. I'm particularly looking at these people who are 75 to 79. Women are quite a bit higher, right, than men. So suggesting that there's gender disparity becomes more pronounced at older ages and disability, even comparing men and women at the same ages. So that's quite significant. We can also kind of do this exact same comparison for urban and rural. So whether we see a difference in the age category, the patterns of age categories for urban or rural. And if we look at that graphically, we see a really strong difference also in the patterns. So you can see for rural, again, we see a really gradual but increasing level of disability or having a limitation. Where in urban, it's a kind of much more flat, and then it goes right up for people who are age 80 and over. It really increases quite dramatically. So you can certainly suggest that people who are at these younger kind of middle ages in an urban area have a much less likelihood of having a disability that early than people in rural areas, where they might certainly have a higher probability of having some kind of disability, even at 65 or 70, where we really wouldn't expect to see that quite as frequently for people in urban areas. We could also do a multivariate analysis of this disability prevalence. So let's say we wanted to combine all these things together. So we could look at their ages, their genders, whether they're urban or rural, and their age groups for developing disability. And we can do that using a logistic regression. I am going to need to, let me open up my file briefly, and I'll comment out whatever is creating this problem really quickly. Let's see, I think it's just how I specified my test. And I'm going to make these available. I also did include this how you write a test actually changed between different waves of Stata. And so I included the old code for how you test things also. So let's jump back to where we were here. We can jump down to our logistic regression. Okay, so that's by gender, by rural. Here's by rural and age. Okay. And if we jump back up, so here's our regression results for our logistic regression. And these are displayed in odds ratios, which are often quite helpful if you're looking at kind of a binary outcome. One of the things to remember then, who is our comparison group? So we're looking at men who are urban, who are age 45 and over. So we're going to interpret these odds ratios as the increase in the probability of having a limitation versus that base group. So you can see women, we would say, even accounting for urban rural and accounting for the age, at all ages, women are 60% more likely to have a limitation. You can see people in rural areas are 80% more likely. And then for the ages, some of these become quite strong, right? So you can see that you are twice as likely to have a limitation to age 55 versus age 45, those 5-year age bands, but 13 times more likely at age 80 and over. And that's to be expected. We know that this is something that happens later in life. I think the more interesting things are when it's not tied exactly to life. It's not tied exactly to age, but to these other things that we're seeing, these disparities amongst gender. So really briefly, we're going to do a cross-sectional, a cross-study analysis. I'll try to do this in 5 minutes here to give time for questions. So we're going to compare China and South Korea using CHARLS and KLOSA. So we're going to, what we want to ask is, are these patterns of disability prevalence the same in China and South Korea, the ones that we have seen in China? So to do that, we need to download and create the harmonized CLOSA. We're going to identify relevant variables. We can do that the same way we did that in CHARLS. We're going to create a pooled data set with observations for both. We can prepare our variables. We're going to apply weights. And we'll talk about how to do that. And then we can do some cross-study analyses. Unlike CHARLS, where you can download the harmonized CHARLS, you actually have to create the harmonized CLOSA data on your own through Stata. But it's not actually as hard as it might sound. So you just need to download the CLOSA data. And we have information about how to do that. From the gateway, you'll then download the CLOSA KLOSA Stata creation code. In that Stata creation code, you only need to edit 2 lines. So basically all you have to do is you have to list where you save the KLOSA data and then where you want to save the harmonized KLOSA data. And once you've done that, you just need to run this only once inside of Stata, and then you can save it. Also, if you don't usually work with Stata, you do have to have access to Stata at least once, but then you could transfer this data set out of any of these, out of Stata, if you're more familiar with SPSS or R or SAS. We're going to identify our relevant variables. For KLOSA, we're going to compare the same year, which is 2018, but in KLOSA, that's going to be wave 7. And we're going to identify the same variables. You can see the naming convention is exactly the same, except for most of these variables that are wave specific have a 7 in them instead of a 4. And then we're going to create a pooled data set. So to do that, firstly, we're just going to save the CHARLS data we've been working with, and we're going to load the harmonized KLOSA data. And then we're going to append back that CHARLS data. And what append does is append just says, take the data that I have and put this new data below it. So it doesn't assume the observations are matching in any way. It's not a merge. It just puts them below it. So you're gonna have inside of your data set, you're gonna have data from both CHARLS and KLOSA. And then we're gonna create an indicator of which study or which country they're from, because we wanna be able to keep track of those. And so if we do that inside of Stata, we can see that we've got a total of 25,000 people. That's from any of the 4 waves inside of China, or 11,000 people from South Korea. The KLOSA study is smaller than the CHARLS study. We're going to create some additional variables just the way we did before. So we're going to create that age categorical variable. We're going to create our limitation variable. And then if you remember that we've got these variables, some which are labeled wave 4 for CHARLS, some which are wave 7 for KLOSA, and we're just going to give those exactly the same name. So we're going to call them, we're going to replace those wave numbers with year numbers. So we're just going to replace R7 or R4 with R2018. And we're going to do that for our age categorical variable, for our rural variable, our limitations variable, and for the weight variable. So we have a weight that's also provided by the KLOSA team, which is also an individual level weight variable for 2018. And then to apply those weights, we're going to use this same SVY set, and we're going to say the probability weight is equal to that combined weight that we made. And this is a really important thing, is that we need to also tell Stata that there is a division in our observations. So it wouldn't be appropriate, for instance, to combine those weights and then generate an estimate and say that, oh, this is an estimate that represents China and KLOSA together, because those weights are not probably scaled for the percentage, for the population of China and KLOSA. They could have done that differently. So in this case, we're going to tell Stata that there's a stratification here, and it's by that country variable that we made. We could then do a cross-study univariate analysis of disability prevalence. So we're just going to look over country, and for the sake of time, we can just look at the graph of that. And one of the things that we see is a really striking difference here between South Korea and China. And this is overall. So, and one of the things that's important to know is that KLOSA doesn't resample people as often as CHARLS does. So one of the things that I know is that in KLOSA at wave 7, there's no one who's younger than 55. So could it be that we're not comparing similar age groups here? And we really do want to compare similar age groups, especially when looking at something like disability, which we expect to be really correlated with age. So we could modify this a little bit. So we could have the same command, but we're going to specify that we only want to look at the subpopulation of people whose age category is 55 and over. So we know that both KLOSA and CHARLS cover these populations in a representative way. Again, it almost affects this comparison not at all. So we can see that it's less than 5% of people we would estimate in South Korea have a disability for people 55 and over, and 20% of people in China. So there's a really striking difference in who has this sort of limitation between these different countries. We could also look whether these countries have different age patterns. And again, we can see a really striking difference here. So we can see that it's really, really low and not increasing very much at all for the South Korean population. I mean, really, it doesn't look like there's any significant increase, certainly not this, not above 10% of the population really until 80 and over. And if you look at China, China, we expect 10% of the population or more at age 55. So there's something that's really different happening with disability across CHARLS and KLOSA, or China and South Korea here. And lastly, to finish it up, we could do a kind of cross-study multivariate analysis. So we could, again, basically we're going to do the same kind of logistic regression, but we're going to add country into it. So if we go through Stata here, we can look at our results. And they will kind of be, what we would expect at this point, which is a really strong difference, even controlling for gender or urban rural or for age. We would say that people in China have almost a 7.5% or 7.5 more times likely to develop a disability than people in South Korea. So it's a really striking difference from two, admittedly very different countries. They're different in size, they're different in levels of income and population, but from the same part of the world. And so again, it kind of goes to illustrate how much diversity there is globally in the aging experience and what can be learned from different people. So this is just an example of kind of a simple analysis. This is part of a series of webinars. So you could look at past webinars that focus on different data sets, or perhaps instead of disability, looking at something else that might be helpful. We also, as part of the gateway, we have news and blogs. So you could also look at those if there's a particular topic or study of interest to you. We also have a help desk. So if you have a question about the gateway in particular, a harmonized data set, or just getting access or getting started to using any of these families as part of the International HRS Family of Studies, you can email us at help@G2Aging. There's a whole team of individuals who work on these resources with us. So we kind of farm out your question to the most appropriate person, and we try to get back to you within 24 hours. So thank you for joining this webinar. And then I think at this time, Hunter and I will just be taking questions for a little while. So if you have questions, again, you can raise your hand. You could ask a question in the question to answer or in the chat. And a recording and the slides will be available, as well as the Stata code, probably by, I would say, sometime tomorrow. Otherwise, thank you so much for joining.